I'm going to demonstrate how to take a manual blood pressure. For many, this is important to be able to do at home on your own. So this is something I learned I do every day with all of my patients, so I thought I would pass it along. The CDC says that the normal blood pressure should be 120 to about 180. I know they are changing that. There's some controversy to that. What we consider a high blood pressure reading is 140 over 90. Anything above that, we would look into hypertension. Low blood pressure would be 105, 110, under 60. That would start leading some other issues. But first, you will get your blood pressure cuff. So I have a cuff here with me. You will also need your stethoscope. You will room your patient, have them sit in a chair with their back to the back of the chair and feet flat on the floor. Give them a few minutes, approximately 5 minutes, to kind of calm down from the rush in, dealing with finances at check-in. Give them a few minutes to unwind. Once those minutes have gone by, like I said, approximately 5, you will, if they have long sleeves on, you need to expose the left arm, the upper bicep. You will place your cuff on the front of your cuff. It will tell you where the artery is, if you can see it there. So you place your cuff on the left arm. It is very important that you make sure you have the correct cuff for the size of your patient. Not all patients' arms are the exact same size, so you wouldn't want to fit, this cuff is a small adult, you wouldn't want to fit this on a very large man's arm. It's going to squeeze and be very painful. But once you have your cuff on, this will give you your readings. So I always clip it there. You will put your stethoscope underneath the artery marking on a bent elbow, flexed arm. Then you want to rapidly increase your pressure. And in your stethoscope, you're going to be listening. We usually inflate 160 to 180 on the measurements, because everybody's blood pressure is different. If they're a new patient, you don't know exactly what it might be. So it's always best to make sure you're going to hear your first beat. Your first beat is going to be your systolic pressure. And that measures the blood vessels when your heart is beating. The last beat you're going to hear is your diastolic, which is what everybody refers to as your resting beat. So that is the blood pressure measures and the pressures in the vessels in your heart when it's resting. So once you get that, there's a knob on your pump. You deflate it slowly. You want to make sure you hear all of your beats. And then once you've heard that second beat, you can do it a little faster. And you just remove the cuff from the Velcro, and you tell your patient what their blood pressure reading is. In our clinic, if we have a high reading, we notify our physicians so that they know that it's something we need to look at. We also tend to start with the left arm, and if they have a high reading, we will also try it in the right arm, and about 5 minutes later, try to see what it reads in the right arm. If that is still high, then we generally know we are dealing with hypertension in a patient.